الحمد لله رب العالمين الرحمن الرحيم مالك يوم الدين.
Hi, my name is Dr. Justin Davis, and today I'd like to tell you about the term hysteria. Hysteria refers to when people lose their self-control due to overwhelming fear, or sometimes have a particular body part that is affected, even though it may actually not have any true disease. The term hysteria is actually an outdated term that physicians don't really use anymore. It was developed a long time ago when doctors used to think that these symptoms only occurred in women. Now today we know that's simply not true, and it occurs equally among men and women. Another name that we often will refer to people that have these kinds of symptoms today is conversion order or psychosomatic illness. That means when you have some form of mental problems or mental disease that leads to physical symptoms. And there's not actually a problem with the physical body, but the person loses function or believes that they lose function in these parts of the body due to the mental illness. What are the symptoms? The symptoms can be very variable depending upon an individual. For an example, perhaps someone has witnessed something very traumatic, like a murder or something extremely disturbing. And after this happens, they suddenly, without any explanation, lose their eyesight and can't see. In conversion disorder, they're not faking these symptoms. They truly have lost their sight, but there's no medical explanation why this has happened. Now the good thing is that rarely these kinds of symptoms last for very long or are permanent, and usually with proper treatment they can be overcome and the person will get better. What can you do to treat this? Well, usually treatment focuses on psychotherapy, since ultimately this is a mental illness. Other kinds of therapy may include group therapy, where groups of people that have similar problems will talk together with a therapist. Also, medications will sometimes be used, particularly kinds of antidepressant medications. How can you prevent this? Well, it's very difficult to prevent since we don't really know why it occurs, and certainly somebody doesn't want it to happen, and so they may not know when it's going to happen. However, if you know somebody that's having a recurrent problem where they seem to lose emotional control, or perhaps they continuously think that they have a very severe physical problem even after doctors have tested them and told them many, many times that there's simply no problem, they may have hysteria or conversion disorder. And in these cases, it's important to get them to a trained professional that can help them.